Welcome to this webinar from the MDU. I'm Dr. Sally Old, and I've been a medico-legal advisor here since 2006. Before that, I was a consultant oncologist in the NHS, although I now help members from all backgrounds with a wide range of medico-legal concerns, such as complaints, inquests, and GMC investigations. Today, I want to talk for 10 minutes or so about how we can manage the pressures of clinical practice. In fact, there's a fairly broad range of resources out there, some specific for healthcare workers and some which are available to everyone. I can't signpost them all today, but hopefully by the end of this talk, you'll have an idea of how to look after yourself and your colleagues and where you might go to get further support. I don't think this slide will come as a surprise to many of you. Working in healthcare is stressful. It always has been. Even before the pandemic hit, surveys were consistently reporting figures of around 40% of NHS workers being unwell due to workplace stress. And again, it is perhaps only to be expected that being in the front line of the COVID response is adding to the pressure. The Institute of Public Policy Research commissioned a YouGov poll of nearly 1,000 healthcare professionals in early April, asking about their quality of life as compared to 8 weeks previously. 88% of respondents said that things had got worse for them, with 50% reporting a decline in mental health and 33% in their physical well-being. So almost all doctors are experiencing some negative effects. To an extent, it is normal to feel like this right now. There should be no stigma attached to talking about it or seeking help to get through these extraordinary times. What can we do to help ourselves? The Academy of Medical Royal Colleges has published some guidance which I've summarised here. There's a lot of information and misinformation going around, and it could easily become overwhelming. They advise sticking to trusted and reliable sources. The old basics are still true. Tobacco, alcohol, and other drugs might seem to offer a short-term solution to our troubles, but we all know that in the long term they can be addictive and very damaging. Eat well, get enough sleep, and take breaks from work so you can keep functioning at your best. Often a short break will really improve our productivity, so we shouldn't feel guilty about taking time to refuel and refresh ourselves. Human decision-making is affected by hunger and tiredness. In 2011, a study of Israeli judges showed they were more likely to grant a prisoner parole if the case was heard first thing in the morning or soon after lunch. Hangry doctors might not always make the best decisions or be the most sympathetic of work colleagues. It's helpful to check in with ourselves from time to time and ask, am I okay? If the answer is no, then it's time to speak up. It's important to keep in touch with and support colleagues. There's a lot we can do to help each other get through difficult times. These are the psychological first aid principles, again from the Academy of Medical Royal Colleges. Look out for colleagues and ask how they are. Do they need a break? Are they more withdrawn than usual? Offer reassurance, practical help, and a listening ear. This is a strategy for managing team members who are finding it hard going. PIES: proximity, immediacy, expectancy, and simplicity. There are tips here for us all, I think, about acting quickly, and that even small acts of kindness can make a big difference. Sometimes we cope okay while we're busy at work and surrounded by colleagues. It might be only once we get home that all the feelings come bursting out. What can we do then? The next few slides will list some of the services available outside the workplace. Firstly, there's this helpline, set up specifically for the pandemic to help NHS staff. It's operated by the Samaritans, and it's worth saying that their general services are still up and running to anyone to access to 24 hours a day, free from any phone. Call 116 123. The BMA also have a 24-hour counselling and advisory service for medics. You don't need to be a BMA member to access this. It's free to all doctors and medical students. As I said at the start, there are a lot of other support services out there. It's worth having a look at what your Royal College or deanery can offer. I thought it might be helpful to mention two charities specifically. The MDU has had a close relationship with the Royal Medical Benevolent Fund for some years, and we're pleased to support their 2020 President's Appeal. The Royal Medical Benevolent Fund helps doctors facing hardship due to age, illness, injury, disability, or bereavement. The Doctors Support Network provides peer support for doctors and medical students with mental health concerns. Some of us will need more formal help with our health. Of course, we can approach our GP, NHS 111, or emergency and crisis services in the usual way. But there are some specific health services provided for doctors seeking an alternative route to confidential help with mental health concerns, including addictions. Practitioner Health Programme covers England, Health for Health Professionals in Wales, and Practitioner Health in the Republic of Ireland. I think it's fair to say that the general public has never been more thankful for the work you are all doing in the NHS. NHS Employees lists various companies who offer free and discounted services as a helping hand to healthcare workers who are working long hours in tough circumstances. At the moment, there are a range of offers, from takeaways to free home workouts, free mobile data, and access to the Santander bike scheme in London. There are also a range of apps to support mental health, which NHS staff can access for free during the pandemic response, including Headspace for mindfulness and meditation, and Sleepio to help you get a good night's rest. Finally, of course, as an MDU member, you can come to us for support. My talk today has been very general, but we know that medico-legal concerns can be a big source of stress. Our medico-legal helpline is there for you 24 hours a day. You can speak to our experienced advisors who will take into account your particular circumstances and suggest options to help you with your specific concerns. We have a free CPD package aimed at foundation doctors but accessible to all, about how to look after your own health and well-being. A free, confidential employee assistance helpline is one of the benefits of our group scheme for GP practices. I hope this brief summary has been of some reassurance that people and services are there for you whenever you need them. These are very difficult times, and I am proud that as a profession, we can help each other to help our patients. You should not suffer in silence or alone. Reach out for help because those around you want to understand, and they are happy to lend a listening ear and a helping hand.